Hello and welcome. I'm Dr. Matt Barber, and this is our joint replacement class to get you prepared for surgery. If you are one of my patients, you definitely need to watch this video. You need to watch it with your family or whoever is going to help coach you after surgery. If you're not one of my patients, welcome. We're happy for you to take in all of this advice and learning. Just remember that every surgeon has a different way of doing things. As always, this is general advice and should not be construed as medical advice that is specific to your situation. Our objectives here are to get you ready for surgery. We want to make sure that you are prepared so that you can have a great experience and a great outcome. If you or your family show up the day of surgery and you've got a bunch of questions for me, I've let you down. We want to educate you in this process. We want to set expectations. That's going to help you maximize your outcome from this, minimize your risk, and you're going to know what to expect. That's going to create a lot less anxiety about this surgery and this process if you're ready for things as they happen. Expectations about surgery. Our goal whenever we do a knee or hip replacement or partial knee replacement or other procedure is a forgotten joint. That is a joint that feels so normal, it's almost like your own. You don't even think about the fact that you have it. The truth is we very rarely get to that, even though it's our goal. This is virtually never like a natural knee or hip after surgery. You can expect to have numbness around the incision. Artificial knees often will have some clicking noise that's very normal. You may have soreness in the soft tissues around your joints, and that's all perfectly normal after surgery. But for most people, there is a marked reduction in the amount of pain versus what they had before surgery, and they'll have a good or excellent result with it. Expectations about surgery. Everyone's experience is going to be unique. Every patient is different. Every patient comes into surgery with different risk profiles, with different functional capacities, with different expectations and different state of health. So everybody's going to have a different outcome and a different experience with surgery. And even for patients who have a knee replacement or a hip replacement on both sides, they'll often have a slightly different experience between the two. That's normal and expected. There are potential risks and complications with any surgery. I always talk patients through those whenever we have a pre-op visit. Those are risk of medical complications like heart attacks or stroke, bleeding, nerve damage, blood clots, anesthesia problems, allergic reactions, things that are typically and fortunately very rare. We really don't expect them to happen, but they kind of go along with any surgery potentially, so you have to be aware of those. Specific to joint replacement surgeries, infections are potentially very serious complications. Fortunately, they typically occur at a rate of about 1% or a little less. And we do everything that we can to minimize these so that our patients can have a great outcome. With orthopedic procedures like joint replacement, there's always a potential for bone fractures, for joints that are too tight or too loose, or some way just don't function like we anticipated. Those are not common occurrences, but if they do happen and they're serious enough, the patient can potentially have to have additional surgeries to correct that. So just be aware of those potential risks, but know that fortunately they're not common. More expectations for after surgery. This is good news. Generally, most patients can do whatever they want to do after surgery. You can typically return to exercise or other things that you like to do. Patients with knee or hip replacements swim, ride bikes, play tennis, some snow ski, do other high demand activities like this. We typically discourage jogging or running, but there is not a lot of published evidence to support the idea that this causes joint replacements to fail. I do have patients that do that. We just watch them very carefully. I advise people that if you can scratch your itch to exercise with other things, that you find things besides running to do, but sometimes it can be done. About 30% of patients after knee replacement may have difficulty kneeling or putting direct pressure on the knee. If that's the case, or if patients have this and they have a job where they have to kneel, or they love to garden or have some other activity that involves that, they will typically use a knee pad to help prevent any issues with that. Hip replacements always have the potential to dislocate or come out of socket. This is fortunately a very rare occurrence, but it's always possible with a prosthetic hip with positions of extreme twisting. So for patients who have a hip replacement, it's important that they take it easy, be good to the joint for the first couple of months after surgery. Once all the soft tissues have healed, the chances of it ever dislocating go way, way down, and there's really not a whole lot that they have to be careful of other than just really extreme twisting positions. As I stated at the beginning of this video, we want to get you ready for surgery. We want to get your coach or your family member or whoever's going to be taking care of you ready as well, so that you can have a great outcome from this surgery. This is something that is happening not to you, but for you. And so if you can get yourself ready, get your home ready, and get prepared, you've got a great chance of having a fantastic outcome from your surgery. As we talked about before, it's very important for you to have a coach, someone who can stay with you for a couple days after surgery at least, up to maybe 2 weeks, depending on the individual. For most patients, after the first couple of days, they can just have somebody with them intermittently during the day and are getting around pretty well. That person, though, is there to help you with fixing meals, bringing you medicine or something to drink, helping to refill ice packs or an ice machine, and to generally help you out with things that may be difficult in the first few days. That person can also monitor your progress. They can make sure that you're being active, but that you're not being too active. And if there are any issues or potential issues, they can help communicate those to my team so that we can help you. Our road to success takes a team approach. We are all in this together. We want you, the patient, to be informed. That's what this video is about. We want you to know about what to expect before and after surgery. We want you to be medically optimized. We want any medical issues that you have to be addressed and to be managed. Certainly people come into surgery with ongoing health concerns. Those will always be there, but we just want to make sure that everything is as good and as tuned up as it can be going into surgery. We want to help you optimize your nutrition. We want your body to be a healing machine after surgery. We want you able to heal, ready to heal, so that you can have a great result. We want you to have a coach, like we talked about, so that somebody is there to encourage you, to monitor you, and help guide you through this process. For me as a surgeon, I am a specialist in these types of procedures. I only do implant procedures of the knee and hip, so knee replacement, hip replacement, partial knee replacement. This is what I do all the time, and that allows us to get very proficient at this. There are multiple studies that demonstrate that surgeons and institutions that do these kind of procedures in high volumes have lower complication rates and better outcomes. We've got a great team put together to help take care of you. In the office, you've no doubt met my nurses and my PAs. They are the core of my team. We certainly interact with nurses and staff at the surgery center and at the hospital. We interact with physical therapists and other providers, but my core team is who you want to go to and lean on to answer your questions, and they can always communicate with me as you can. Nutritional optimization, like I said, we want you ready for surgery. We want you to heal. The big driver for this after surgery is protein. This is what your body needs to heal tissues. We want you to get 100 grams a day or more if possible. Focus on just healthy foods, lean meats, greens, whole grains, berries, nuts. Definitely before and after surgery, try to avoid a lot of processed foods, fried foods, things with a lot of sugar that just aren't good for us really almost any time. We'd like you to take a multivitamin daily, as well as 2,000 IUs, international units of vitamin D3 daily. These are our very general recommendations. If you have a specialist, any other doctor who takes care of you, and they put you on a specialized diet, you should absolutely be doing what they tell you to do, even if it deviates from this. I usually don't recommend a lot of things very specifically, but I very much encourage my patients to take the Mend joint replacement formula. We should have given you a flyer on where to order this. Start this a week or two before surgery if possible, and continue for at least 2 weeks after surgery, ideally maybe about 4 weeks. This is an essential amino acid supplement that has been shown in multiple studies to help improve healing and to decrease muscle loss after these types of surgeries. If that is not an option for you or available, IsoPure protein amino acid type drinks are also a decent substitute for that. You can get those at the health food stores or through online retailers. Mend at this time, I believe, has to be specifically ordered from that company. We want to get your home ready for surgery as well. This is where you're going to be recovering. I am overwhelmingly in favor of you being home versus in a hospital or any type of skilled nursing facility. This is an environment that you know. This is an environment where all the bacteria that live there are known to you. There are no institutional germs in your house. We know from some studies that fall rates are actually lower in your home than they are in an institution. You know your way around. You know what's there. So we think it's the safest place to recover, and I always encourage that whenever possible. So let's make it even safer. Any type of tripping hazards. If you have throw rugs, cords, anything that would obscure your path or potentially cause you to trip, get it out of there. Move it, get it stowed away before you come home from surgery. Things that you're going to need, frequently place them at arm level, remote controls, anything like that that you may want or need. Areas that are dark, you may want to look at getting some small lights or lamps so that you can keep those lit during the night. Again, we're trying to avoid falls and tripping. Non-skid surfaces for showers, any kind of clutter. Make arrangements for your pets. You know, that German Shepherd may need to get boarded for a little while. Your goldfish is probably okay. We don't want any animals that are going to jump on you, knock you over, or cause any problems with your surgical site. Think about stairs. I do surgeries on folks all the time who have stairs into their home or inside their home. That's very much okay. You will be able to do those after a knee or hip replacement surgery. It will just be very slow initially. So you have to plan those trips, plan how you're going to set it up. Some patients will set up a sleeping arrangement on the first floor of their home, even if their bedroom is not normally there. Some people will go upstairs to their bedroom, but go upstairs and downstairs once a day and try to plan those trips kind of carefully. They lay out their day, they make a plan. Just know what you've got to deal with and think about it ahead of time. You'll do fine. Anything you can do for the nutrition side and to make things easy afterwards as far as meal prep, get some things ready, stock up the pantry, freeze some meals, fix some things, get them ready so that it's easy for you to do after surgery. You will have a preoperative visit. This is done at our office at this time, but that varies from time to time and could be moved to the surgery center or hospital. Don't worry about that part. Know that this changes every now and then. But generally, you are going to be seen a few weeks before surgery. You'll have blood work drawn for labs. You'll have an EKG performed. You may be asked a few interview questions. Usually on that same day, you'll have a preoperative visit with a physical therapist to go over our protocol, talk about things after surgery. Please feel free to ask them any questions you have about stairs or getting in and out of bed or getting in and out of a car or any concerns that you might have. During that time, you will probably be given a wash kit or some instructions about skin cleansing to do the day before surgery or the morning of surgery. You may also be given an antibacterial preparation to put inside of your nose immediately before surgery. That's to help reduce bacteria that may have colonized in the nostrils. This will change from time to time, but generally follows this pattern. We're hoping to get all of your lab work done, make sure that you are clear for surgery, that you don't need any additional testing, and that we've done everything to get you ready in terms of expectations with physical therapy and activity after surgery, and skin cleansing to make sure that we reduce infection in every way that we possibly can. A big focus in our practice is preventing complications. We want you to do well. So preventing blood clots, this is a big fear for a lot of patients. Fortunately, having a symptomatic blood clot is actually statistically very rare. Things that we want to do to prevent that, we just want to be efficient in our surgical times. We want to avoid really long surgeries whenever we can. We use less invasive techniques whenever we can. Very early and frequent mobilization after surgery. You'll see more in my video about home exercises, how we use ankle pumps to help recirculate blood and keep it from pooling up in your legs, and short walks. And those are really the heavy lifters in terms of getting your blood flowing and helping reduce your risk of clots. You will be on some type of medication typically to prevent blood clots after surgery. For the majority of patients, that's going to be low-dose aspirin. If you have a strong personal or family history of blood clots, or if you are on blood thinners already for another condition, then you may be on a more aggressive or different blood thinner, such as Eliquis, Xarelto, or other medication after surgery. Stockings, like you see in the picture, I do not use routinely. These do not actually help prevent blood clots, so I don't use them routinely, and many surgeons across the country have stopped. In some patients who may have some edema or some swelling in their legs that persist several weeks after surgery, we'll sometimes use them for that purpose, but we don't use them routinely. As we said, we want to do absolutely everything we can to prevent complications. Infection is a big one. Some things that we employ if you're having a knee or hip replacement, you should not have any injections in that operative joint for 3 months prior to surgery. So cortisone injections or other injections, hold off on any of those in close proximity to surgery. That can increase your infection risk. Your skin, we don't want you to not have any scratches or wounds, especially on the operative leg. So maybe hold off on the yard work or horsing around with your pets a lot in the week or so before surgery. We want good, clean, intact skin. Do not shave the leg for approximately 3 days or so before surgery. The nicks that are created can be little spots for bacteria to hide in. You will have hair removed with special skin clippers by staff in the operating room at the time of surgery, but don't worry about shaving the leg in the few days prior to surgery. Medical issues like diabetes or obesity or smoking, those need to be managed. Diabetes needs to be very well controlled. Some patients are considered too obese for surgery in the short term. We want to get their weight down to reduce their risk and then come back and do surgery at that point. Smoking is a huge risk factor for infection and wound healing complications. We certainly encourage everyone to stop. Even if you're not able to stop forever, if you can quit for a month or so before surgery and a month or two after, that helps to reduce risk. Preoperatively, we cleanse the skin with chlorhexidine and the nose prep that we talked about. You will receive antibiotics by IV. During surgery, we're going to try to be efficient with our technique and obviously observe strict sterile technique. Preventing pain and treating pain is a huge focus of our practice for a lot of reasons. This helps to maintain a good experience with the surgery. It also helps to prevent complications like stiffness or problems that result from lack of mobility like blood clots. The better controlled your pain is, the better you're going to do after surgery. You're going to heal and recover faster and have a better outcome. So the day of surgery, you will receive what we call multimodal pain control. That means that we use a bunch of different treatments to try to control your pain. So before surgery, you typically are going to receive some anti-inflammatory medicines, nerve pain medicines, steroids. Then after surgery, we're going to use the cryotherapy, the ice machine that you see there, steroids, elevation, all these things to help control pain. Immediately prior to surgery, you will have one or more nerve blocks that can help to control pain, especially for knee surgery. Those are not as common with hip surgery, but they really help to control pain for the first couple of days after surgery, depending on what medications are used in those nerve blocks. We are very passionate about doing opioid-sparing surgery. We usually try very hard to have our patients take as few narcotics as possible and to avoid refilling narcotic medications unless there's really extenuating circumstances. The reason for that is 6, 13, and 30. For surgeons, these are scary numbers, because what we've learned on the tail end of the opioid crisis is that unfortunately our operating rooms can become a gateway to an opiate addiction for a lot of patients. Something that we're doing to help them can turn out to be something that hurts them. From some guidance and a study from the Centers for Disease Control, we know that patients who receive a one-day prescription of opiates have a 6% risk of still being on those medications 1 year after surgery. For patients that receive a 1 week prescription for opiates, they have a 13% risk of being on those medications a year after surgery. And for someone who receives a 1 month or 30-day prescription for narcotics, they have a 30% risk of still being on them 1 year after surgery. That's very sobering for us. We know that you will need some pain medicine in the first few days after surgery. We try to use that appropriately and wean you down from those type of addictive narcotic medicines as quickly as we can. Controlling swelling, particularly after knee surgery, and the use of cryotherapy with ice machine type devices has been a huge emphasis in my practice in the last couple of years. I've really come to understand that in the immediate weeks post-op, we want to get motion of a knee, we want to get it straightening, we want to get it bending, but we really want to focus on controlling swelling. That's what allows people to heal, allows them to get a good range of motion and have a good functional result after surgery. So cryotherapy or use of the ice machine like you see in the picture helps a lot with that swelling and pain control. We want to use that very frequently, but carefully. Most of the circulating cold water devices have a pad that prevents it from being too cold or being directly on the skin and provides a nice buffer. But especially if you were using ice packs or a bag of ice or something more direct, use a thin towel or a pillowcase or some type of barrier between your skin and the ice pack. With the ice machine, you can probably do 40 minutes or more at a time. With ice packs, you may want to limit it to 20 or 30 minutes and make sure that you take breaks from that and allow the extremity to warm back up to room temperature. Care of your incision. This is always a little bit different for every patient, but generally we put a dressing on during surgery that is completely sealed. It's antimicrobial, so it helps to prevent infection and has some type of a mechanism to soak up any small amount of drainage or blood. Very normal in the first few days after surgery to have a little bit of drainage from a knee or hip or a little bit of bleeding. Most of the time, the bandage will soak that up. These are sealed. You can shower with them on immediately. If the bandage fills up and starts to look like the picture that you see on the lower right, then you want to talk to our staff about getting in to have that changed. There are some additional treatments with collagen-based dressings or some programs where we provide dressings for patients to change. Unfortunately, that varies a lot and can depend on your insurance. But the biggest thing is just don't do anything to change or remove the dressing until you've communicated directly with my staff or you receive instructions from us about changing the bandage. Some patients ask about dental clearance prior to surgery. We do not routinely require this. The studies on this have shown that if you are having regular dental care and you don't have any pain in your mouth, then you do not require dental clearance. If you've not seen a dentist for several years, if you have the potential for cavities or abscessed teeth or anything that would be a source of infection, then you need to get seen by a dentist prior to surgery and have that checked out. Any dental care or cleaning, ideally, if you can do this within a few weeks before surgery, then you shouldn't need anything for a while after. We would prefer that you wait at least 3 months after surgery to have any cleanings or elective dental work. The reason for this is that cleaning, particularly below the gum line, can cause bacteria to get into your bloodstream and potentially be a source of infection for a prosthetic joint. There is substantial variability among dentists and surgeons, but most of us recommend that you take antibiotics prior to dental cleanings, at least for the first couple of years after a joint replacement surgery. And then after 2 years, depending on your overall health, how many joint replacements, it may be reasonable to discontinue that or continue that based on your particular health history. For the same type of reason as the teeth cleaning, we recommend that you not have manicure or pedicure for about 3 months after surgery. Avoiding bowel issues after surgery is really important. Obviously, it's awkward for us to be talking about your poops, but this is an important consideration. Everything that you receive in terms of anesthetic medications, narcotics, all these medicines that we're giving you in and around the time of surgery very much can lead to constipation. So be aware of that from the outset. We recommend that patients start taking Miralax, at least 1 serving daily. If you're prone to constipation, probably start a day or 2 before surgery. If you're not, you can start after surgery. This type of medication works by having liquids with it, so drink plenty of water, plenty of fluids with that. Obviously, try to limit the narcotic pain medication. Don't wait until you've been several days without a bowel movement to start taking this or to contact us. Start early on. If you sense a problem or are having any issues, let us know. You can often treat that by upping the dose of Miralax or adding in some other medications. But stay on top of that. You're going to have a much better experience if you know this ahead of time and avoid any problems. This slide is primarily focused on physical therapy after knee replacement surgery. For hip replacement surgery, my preference is short walks and ankle pump exercises to prevent blood clots. We try to keep that real easy and real low key after surgery. Most of you will probably have a home therapist that's coaching you through some of that. We just try to start real easy and get you walking. Knee replacement's a little bit different. Therapy is really important. When you have a visit preoperatively with our physical therapist, they're going to go over with you my particular protocol. They should be talking with you about how to get in and out of your home safely, stair climbing, getting in and out of a bed, a vehicle, really basic things to help you function after surgery. You will get a separate video from me as well as a written handout about your exercises to do after knee surgery. They are very simple. They include straightening the knee, bending the knee, ankle pumps to help prevent blood clots, and a short walk. That's it. It's really basic. What we're after knee replacement, as I said, is getting that range of motion early on and keeping the swelling down. We're not going to progress with strengthening, extended walks, or heavy exercise until much later after you've had a chance to heal. If you do too much too soon, you will likely have a lot of swelling. You will likely cause a setback during your rehabilitation that you don't want to have. We typically have a home therapist coming out to coach you through some of that in the first couple of weeks after surgery. But my exercise protocol is pretty simple and pretty self-explanatory. And we do have patients who do that on their own without the supervision of a therapist. It can work well on its own or in a hybrid model with a therapist. I do not use CPM or continuous passive motion machines, as you see in the bottom right. I used these machines for years. All of the data and published evidence is that they do not help improve outcomes or range of motion after surgery, and I stopped using them several years ago. Our results have improved substantially since that time. I understand that that can be awkward if I did surgery on you years ago and used one, or you have friends or neighbors who used one, but the overwhelming evidence is that they don't help in final outcomes, and we are much more comfortable with our particular protocol. Your therapist will help transition you to outpatient therapy, usually about 2 weeks after surgery, and then at some point you'll transition to doing home exercises on your own. We want people to do well. We want people to get back to doing what they want to do. But early on after surgery, the focus just needs to be safety. That's not the time to be lifting or carrying something heavy or doing things without support where you might fall or where you're on uneven ground. If you'll be good to your joints for the first couple of months after surgery and really allow everything to heal, the chances of you having an issue or causing a severe complication go way, way down. So heal, do the therapy, do the work that you need to do, but allow things to heal. To get ready for surgery, you need to know what to do and not do as far as taking your medications. So 1 week before surgery, we want to stop any blood thinners. That's Plavix, Xarelto, aspirin, Eliquis, all types of medications like that. Obviously, you're having surgery. We don't want you to have a bleeding event during that time. We also stop anti-inflammatory medicines. Unfortunately, this may make your joints a little more sore and painful in that last week before surgery, but ibuprofen, Aleve, Celebrex, all of those can act as a mild blood thinner, and so we want to avoid those going into surgery. It is okay to keep taking your vitamins, minerals, probiotics, vitamin C, vitamin D, multivitamins, all of those types of supplements. We would ask that you stop any separate high-dose vitamin E, your multivitamins, your food, all types of things that you ingest will contain vitamin E. We just don't want you taking mega doses of it. It can have a similar mild blood thinning effect. You need to stop herbal supplements. That's ginkgo, ephedra, St. John's wort, kava, valerian. A lot of these supplements can interact with particular anesthetic agents and cause reactions or problems. A lot of them have unknown interactions, so we don't want to see your surgery held up or postponed in any way. So just go ahead and stop those 1 week before surgery. You can resume them after surgery. Ozempic, Wegovy, a lot of the GLP-1 weight loss medications, Mounjaro, things of this type and category you will need to stop before surgery. So all of those medications slow down your gastric emptying, and there's the concern with anesthesia that you could have reflux or aspiration. You want to stop those approximately one dosing cycle before. In other words, if it's something that you take or inject once a week, stop it a week or two before. If it's something that you take by mouth every day, stop it about 2 days before. 2 to 3 days before surgery, you need to stop stimulant medications. These are primarily for ADD, weight loss, things of that nature. Adderall, Vyvanse, Ritalin, Adipex, things like that. All of those, again, can interact or have potential harmful implications with your anesthesia, so we need to stop those about 2 to 3 days before surgery so everything goes off on schedule. Day of surgery, the big day is finally here. Just a few things to remember to do this right. Do not eat on the day of surgery. Pretty simple. Don't eat anything. Do take your blood pressure medications. Any of those are fine to take with a sip of water the morning of surgery. Any inhalers that you might use for asthma or other conditions are fine to use as prescribed. You can drink clear, non-alcoholic liquids until 2 hours before your arrival time. We think about things in terms of your arrival time. We don't always know the time that your surgery will start. So whatever time you were told to arrive at the surgery center or hospital, shut off any liquid intake 2 hours before that. Clear liquids, sports drinks, water, black coffee, no cream in coffee, no juices with any kind of pulp. We want things that are clear and light. So after surgery, we want to familiarize you with a lot of the medications that you might have. So we're going to talk about some broad categories of medications so that you understand them. You likely will not have all of these. These are tailored to different patients based on their medical history, based on their age, based on the type of surgery, multiple other factors. So you will have some type of pain medicine. The most common would be Norco or Percocet. That's oxycodone or hydrocodone containing acetaminophen or Tylenol. These are both very powerful narcotics. They are addictive, as we mentioned earlier, so we want to use those very carefully. You may also receive tramadol. This is a medication for pain that we use very frequently. It is also a controlled substance, technically a narcotic, typically somewhat milder and better tolerated than the two others. With any of these medications, there have been some national shortages of these. At times, there are issues with particular pharmacies that may or may not fill these before surgery, that may or may not fill certain amounts. We will do our absolute best to get your prescription somewhere in a timely manner where it can be filled so you have it ready after surgery. But be aware that those can sometimes be a little tricky, and we may have to adjust to get you your medicine and get it to you. We've generally found that a lot of the smaller independent pharmacies tend to be a little more workable and flexible than some of the larger big box retailers and pharmacies. Tranexamic acid is not a pain medicine, but is something that helps control bleeding after surgery, and you may be prescribed some of this or perhaps not. The anti-inflammatory medicines that we told you to stop taking before surgery, you will very likely be on some after surgery. Controlling inflammation helps control pain, helps control swelling, very helpful after your surgery. The important things to remember are that all of these can cause stomach irritation. So if you have GI symptoms or you have a history of ulcers, be very, very careful with these. Similarly, if you have any renal or kidney problems, be aware and just know that going in. Very important to pick one. If you're taking Celebrex, you don't need to also be taking ibuprofen. We kind of ask you to pick one, find one that if you know it works well for you, we'll prescribe that, and let's keep you on one of those and not be taking multiple at the same time or alternating them between doses or day to day. Tylenol, acetaminophen, is quite helpful for pain. Very old medication, very safe, very effective. Just bear in mind that the prescription for Percocet or Norco that you may have also contains acetaminophen, so you want to be careful about getting the maximum dose. Miralax that we recommended earlier to help prevent constipation. Just make sure that you are taking that with lots of water or liquids. Know that you can increase the dose to a double or even quadruple dose if needed to relieve constipation those first few days after surgery. Many people will be on a small dose of oral steroids for a few days. Again, this is intended to help with swelling, pain, inflammation, so that we can get everything healed, get you up and moving. That's very effective for a lot of patients. Antibiotics, if you have them prescribed, take the full course. Start taking them immediately after surgery and continue those until they have been completed. This is just another measure to help prevent infections. We spoke a little bit earlier when we were considering complications about blood thinners. For most patients, we use a low-dose aspirin, an 81 milligram aspirin twice a day. Other patients who are at higher risk or who are already on blood thinners may be on a different medication. By 6 weeks out from surgery, as long as you're healing well and moving around well, you can discontinue this and go back to whatever you were doing before surgery. If you were taking a single aspirin daily, if you were on a different blood thinner, or if you were not taking anything at all, you can revert to that. When you connect with our office and my nurses, try, if at all possible, to get refill requests in Monday through Thursday during business hours, and give us 24 to 48 hours to get to those, especially for the controlled substances, the narcotics. Those have to be signed off by me. I'm very frequently in the operating room, so there can be a lag. Try to anticipate this if you think you're going to need something else, and let us know so that we can work that out with you. The day of surgery has arrived. When you get to the surgery center or hospital that day, make sure to wear comfortable clothes. You want something that's loose, easy to take on and off, but is not a tripping hazard for you. You'll need to bring your identification and your insurance card unless you have pre-registered and you are absolutely certain that everyone there has all of your information. If for some reason you're staying overnight in the hospital, you may need to bring your CPAP machine with you so that it's available after surgery. It is okay to wear nail polish. All the monitors and everything work just fine with that on. You may want to have your walker in the car and available for that transition from the car into your home. You'll see me a little bit that morning of. If we're at the day of surgery and we're in the pre-op area and you've got a bunch of questions for me, I've let you down. I've failed you. So watch this video, watch it multiple times, try to get everything covered that you need to know about. And if there are any questions, just email me, barbertotaljoint@alortho.com. Let me get that handled for you, for your family, before surgery. The day of surgery is a very poor time for us to all be intaking new information, so we want to get that handled. You'll get interviewed by the nurses. They will cleanse the skin, probably clip some hair, start an IV for you. You'll meet the anesthesia team, likely a nurse anesthetist and an anesthesiologist. They will talk with you about nerve block for knee replacement, general versus spinal anesthetic. We do lots of these with both different types of anesthesia, and both can do very well. Some of that varies by location, some of that varies by your medical history. But talk with your anesthesiologist. They will get you set up with that and take great care of you. Surgery, in big green letters. You finally made it. You've had your surgery. I get asked commonly, how long does surgery take? For most joint replacement procedures, a primary knee replacement, a primary hip replacement, they take about an hour. So some may be a little bit quicker, some may be a little bit longer. That just depends on the condition of your joint, your size, your overall health, and how things are going that day, but generally takes about an hour. Revision surgeries typically will be quite a bit longer. So you've had your surgery. When you get to the recovery room, everyone's going to make sure that you're doing well, that you're waking up and feeling okay, that we've got some reasonable pain control for you. Physical therapist will come and see you. We're not after you showing off or doing too much. We just want to make sure that you're safe to use your walker, that you've got good standing balance, and that you'll be able to get yourself back and forth to the restroom. At that point, you will leave the recovery room for a lot, or for most of you, you'll be headed home. Some of you may be headed to a hospital room for a short stay. During that time, that first day, just want you to rest. The big focus is on ice to knees especially, but also to hips to help control swelling and inflammation, and elevation of the operative leg. That's going to help a lot with the swelling. My exercise protocol that you'll get, we've talked about a little bit. It's very simple. If you get a chance to run through those exercises 2 or maybe 3 times tops on the day of surgery, that's plenty. Otherwise, we just want you to rest, elevate, ice, just short trips to the bathroom when you need to. Use your walker. We want you to be safe. We want you to be stable. Again, we're not trying to show off. We're trying to take everything easy and navigate you through these early hours and days after surgery. If you see the graphic on the bottom right, we don't want you to sleep with a pillow directly behind your knee. Often after knee replacement surgery, the most comfortable position is with the knee bent just a little bit like that. It's okay to do that some and for a little while during the day, but if you hold that position too long, it can be difficult to get the knee extended or fully straightened out. So spend as much time as you can tolerate with something under your heel so that your knee can hang straight. You can get that nice full extension with your knee that allows you to stand easily and well after your surgery is healed. In this next section, we want to walk you through some of the things that you likely will be experiencing in the early postoperative days after a knee or hip replacement. Generally, a lot of these things apply to knee. Hip is very similar, but maybe a little bit less. Knees are certainly a little more sensitive to swelling and some of the other issues that we talk about here. So post-op day 1, that's the day after surgery. Expect that your leg is going to feel heavy. It may have burning sensation around the leg. You obviously may notice some numbness as well from the nerve block in different parts of your leg. That's very normal. Big focus, just like the day before, is icing and elevation. Let's keep that swelling out of your leg. Take your medications as prescribed. Pain medicines just as needed. Take all of your other scheduled medications as they're instructed. Want to do the therapy protocol that we demonstrate with you. So every hour, you're going to work on a short walk. A short walk is not to your mailbox or down the road. A short walk is to your kitchen or to your bathroom. And do those 10 ankle pumps where you squeeze your calf. That's going to help prevent blood clots, those 2 exercises in combination. For hip replacements, if you do that, you're done. For folks with knee replacement, you're going to do 10 of the straightening exercises and 10 of the bending exercises. And then you're done. Those exercises all total should take you about 7 or 8 minutes to do, and you need to do those every hour while you're awake. Don't wake yourself up to do it, but every hour while you're awake. Nutritionally, you want to get plenty of fluids. You want to keep yourself hydrated. Don't go crazy. Eat frequent but small meals. Everything is slowed down from anesthesia and from all the medications. Take several deep breaths an hour to clear your lungs out. Just deep breathing, coughing if you need to. That's one of the conditions that can occur after any type of surgery where your lungs close down a little bit and you need to open everything back up. We talked about Miralax already a couple of times. Do that to help prevent constipation. We want to cut that off before it happens. Your nerve block's probably wearing off somewhat depending on what type you had, and you're starting to swell at some point in here. Your leg will probably reach its maximum level of swelling tonight or into the next day. So keep those exercises just as instructed, activities in moderation, especially if you're feeling great, the nerve block's working well. It's tempting to do a little more, be a little more active, but Try to rein it in, spend lots of time elevating and icing. Day 2 after surgery. This is often a tough day for people. The swelling has kind of maximized at this point. The hip or leg may feel heavy, tight. You may have some throbbing. Things that we do for this are the same. We want to elevate, ice, gentle movement, do your exercises, but again, don't go crazy with that. We want to keep your activity fairly low. Just do what we need to do. Drink plenty of fluids, small meals. Need to have a bowel movement certainly by this day. Keep taking the Miralax as instructed or increase the dose if you need to. Still on a similar course here for post-op day 3 and 4. You may notice some bruising developing on your leg. You may have some redness around the leg or certain parts of it. You may have some warmth. That's very normal. There will be some amount of warmth on your operative extremity for several months after surgery. Now, hopefully that becomes less and less in the few days and weeks afterwards, but very normal for it to feel warm, for it to have some redness or bruising. That's totally appropriate and fine. Keep icing, elevating, and doing your motion exercises and your PT protocol as you've been instructed. Diet's the same, lots of fluids, those small, healthy, protein-rich meals. Make sure you're not getting constipated. The narcotic medications, the opiates, just take those if necessary. You can start trying to wean down from that whenever you're feeling better after surgery. Don't worry about pain. Don't let the fear of pain freak you out. You're going to have some discomfort in these early days. It is definitely not forever. This will get better, so don't let a lot of anxiety about that build up. Use your ice, use your elevation, use your medications as you need to. Keep that under control, and then start weaning down from the medications as soon as you can. Day 3 and on through the first couple of weeks after surgery, it is very normal for the operative leg to be swollen. Continue to elevate that. Use ice. If that's not improving, let us know in case we need to check something out for you. Follow the PT protocol like we instructed. Keep doing your deep breathing. Plenty of fluids, plenty of small, protein-rich, nutritious meals. Understand that sleep can be difficult during these first couple of weeks and months after surgery. That's pretty common, so just do your best with that. Try to avoid caffeine or alcohol or things that can dehydrate you. Continue to drink plenty of fluids. You can start to wean yourself from some of the medications during this time. Continuing your journey, day 3 through 2 weeks after surgery. Hopefully you're progressing well. Take everything slow and easy. At some point along the line, you progressed from a walker to a cane, hopefully, or may have even gotten rid of a cane. But generally, we want the focus to be on safety, so don't be any more aggressive about that than you need to. Take your time. For a fair amount of patients, there seems to be a pain spike in that first week or so after surgery, where they may have been doing really well and then their pain increases. Very normal. For a lot of patients, that's related to sciatica. We see that both after hip replacement and knee replacement. And just know that it happens to a fair amount of people. And let us know there are some things that we can do to treat that. A lot of patients will also describe having a blue day or a blue time somewhere in that first week or so where they just have a mini meltdown or they're feeling really down. It can be a lot getting over a big surgery like this. If you have that, just know that it's normal. What you're experiencing is not going to be forever, and that this will continue to improve. As you're walking, you may notice that your knee clicks or makes some other noise. Again, that's normal, like we talked about, and nothing to worry about. Things to be mindful of: if you're having severe redness or redness that's getting worse, or you're having drainage or having fevers, you want to let us know. Communicate that to my nurses so that they can let me know. We we may need to check you for signs of infection. Week 2 and beyond. Certainly you are still likely having some swelling, some stiffness. It will take several months to a year for the soft tissues around your new joint to heal, and during that time, they will likely get stiff or sore quite easily. That's okay, and that's normal. At some point around 2 weeks, a lot of patients who have had a left knee or hip replacement may resume driving. Your surgeon never clears you to drive. It's something you have to start doing again when you feel safe and feel comfortable doing so. Never do that while you're on narcotics. When you think about a left knee or hip replacement, a lot of those patients will be back driving about 2 weeks after surgery. For right knee or right hip patients, much more commonly, it's about a month or so, just because that's the primary leg that you use while driving. Just be safe. Ease back into that when you're comfortable and when we're all safe to be on the road with you. While your incision is healing, we don't want any lotions or ointments directly on the incision. You can put topical medications or ointments in the areas around the joint, just not directly on the incision until it's fully healed. This is usually about 4 weeks or so after surgery. No pools or tubs until the incision is fully healed. Again, for most people, 3 to 4 weeks, somewhere in that range. We want everything really healed, clean, and dry. Showers are fine, just don't fully immerse the operative site in a pool or a tub until it's fully healed. During this time, you'll want to continue to wean the medications. We certainly hope that you are off of narcotic medications by this time. Tylenol and anti-inflammatory medicines are very effective for pain control as you're continuing to heal. Continue to use your ice and elevation as you've been instructed. As we get to week 4 and beyond, hopefully you are progressing very well. Sleep can still be difficult for a lot of patients. That's not abnormal. Just do your best with that. Let us know if you're having a particular problem and we'll try to help. Don't overdo it during this time. You can start to progress slowly back into activities that you like to do, some very low impact sports, but we want to avoid very uneven surfaces, situations where you might fall or where you might have to support yourself on one leg. We want everything to be gentle and easy at this point. Kneeling, you can do so occasionally. Be gentle with that. Use a pad if you need to. After knee replacement, this can take quite a while. And as we discussed, some patients may always have a little bit of difficulty with this. Surgical site can still be warm during this time, especially knees. That's very normal and not indicative that there's a problem. Obviously, worsening pain, worsening swelling, worsening redness, those are things that we need to know about. It is okay to massage the scar after it's fully healed. Once that incision's closed up, you can rub lotion, cocoa butter, vitamin E cream, scar creams, things like that around the incision. That'll help to make the tissues feel better as they heal. Some general thoughts during the first few months after surgery. You will likely see us at 2 weeks after surgery and approximately 6 weeks after surgery for your follow-up visits. We'll be checking in to see how you're doing. If there are issues, we may see you more often to double check on things. Dental care, we, again, as mentioned, would like to see you get 3 months or more after surgery before you proceed with any type of dental cleanings or elective procedures, and take antibiotics before you do so. You certainly may still have stiffness around your replaced joint. It's still healing. Remember that that's very normal. Even though the joint surfaces are now replaced with prosthetic components, the soft tissues still have to heal, and that's an ongoing process. You want to treat any infections. Obviously, we're not talking about an infection of your prosthesis, but any other infections that you have, be that a urinary tract infection, sinus infection, a cut or scrape. We don't want bacteria to find a way into your body from some other site and cause an infection of your new joint. We want to avoid impact loading during that time. We want to progress gently back to your sports and other activities. Remember, you've got a long time to do these things after you heal, so it's not necessary to push back into it any sooner than necessary. In the months and years after your joint replacement, we'll be seeing you back for the occasional follow-up visit. We hope that you're doing really well during this time, that you've had excellent relief of your pain, and that you're back to doing all the things in your life that you love to do and want to do. In most cases, we may not see you for quite a while, and what we need to know about are any changes. It's very normal to have some soreness or pain around a prosthetic joint. These tissues around the implants can be strained, just like mine or anyone else's. So if you tweak something and have pain for a few days and it gets better, that's perfectly fine. If you have severe pain, however, or if you have pain or changes that are new and don't go away, let us know so we can get you back in and check this. Historically, in joint replacement, we used to see patients for routine surveillance of their implants every year or two. That is now very much being called into question. With modern implants, we just really don't expect to have a lot of issues. We expect these implants to last not just years, but decades in most cases. And so you really don't necessarily need to see us unless you're having a problem. If every 4 or 5 years you want to stop in and have it x-rayed and have it checked, perfectly reasonable. But obviously reach out to us if you're having any problems. We hope you're doing great, that your joint replacement has been a fantastic experience for you during this time afterwards.